So I'm so glad that today we're able to officially announce that the federal government and the government of British Columbia have reached an agreement in principle that moves us forward on healthcare. Thank you, David. In fact, I can actually add one more to the list today. We now have a signed agreement with Saskatchewan as well. We're glad to have them take the step with us and be part of improving our healthcare systems across the country from coast to coast to coast. Both provinces will join the 7 others that have already signed on in creating 3-year action plans that map out exactly how they will use these funds to make the improvements that Canadians are counting on. Each agreement will be tailored and flexible to the needs of each province and territory, but consistent among all is the joint responsibility to collect information that monitors how the healthcare system is performing so we know that it is delivering the improvements that Canadians deserve. Things like the percentage of Canadians who have access to a family doctor or nurse practitioner and tracking to make sure that that percentage keeps increasing. Or how long wait lists for appointments and surgeries are and whether they're decreasing. More access to mental health care and substance use care, which I know is a shared priority with our partners here in BC, where you're all on the front lines of the opioid epidemic. And moving towards a more modern system that allows for you to securely share your health information with your entire healthcare team. We're doing this because what gets measured gets done. Another element of our plan is asking provinces and territories to improve how we recognize foreign credentials for health professionals so that it's easier for nurses like the ones I met here at KPU Langley to get their careers started, treat patients, and be part of easing the pressure on our overworked healthcare professionals. We're also committing $2 billion for an Indigenous Health Equity Fund to support First Nations, Inuit, and Métis partners in closing healthcare gaps.
Today, with the federal government, we are taking that big step towards protecting and strengthening public healthcare in our province. That's public healthcare that all British Columbians can rely on. Having the federal government as a strong partner with an agreement in principle that we're announcing today means that we're able to ensure stable, secure funding going forward. Another $6 billion to stabilize healthcare in our province, and more than $3 billion over 10 years for targeted funding in priority areas where we agree with the federal government more needs to be done.